Welcome to the Expressoul Health and Wellness Podcast. In each episode, you'll learn from experts about the best practices and technologies to live a happier, healthier, and hopefully a longer life. Here is your host, Claudia Erdenola.
My name is Claudia Urdinola. I am a professional engineer with a passion for health and wellness. Every week, I bring different doctors or health experts to talk about different topics into the wellness community. You and I, learn with those experts on better ways, new practices, and technologies that we can implement at home to take control of our health, to live longer and happier life. So if this is of your interest, please subscribe to our podcast and hit the notification button so you'll be notified every time we bring new content to our channel. Also, please follow us in all our social media outlets, and more importantly, leave your comments below and let us know how much you liked our content by giving us a 5-star review. Also, all of this content is brought to you free of charge. So we kindly ask you to support us with our sponsors. So my sponsor to my podcast is Expressoul Coffee. Expressoul Coffee is my brand of coffee. I designed this brand with your health in mind. Why? Because this coffee is clean, organic, free of mold and pesticides. So why you gonna settle for that commercially available coffee that is all full of molds and is old and over processed when you can get the best coffee available in the market for your health? My coffee comes from the high altitude mountains in Colombia, Central America, and Brazil as well. And we work with these farmers. There are small farmers that take care of those plants in a traditional way. They understand that the quality of the water, the volcanic rich soils, the birds, the trees that give the shade to the coffee plants, all of that combined keeps the qualities of the beans that we bring at Expressoul Coffee. All my coffees are available also in a presentation for the K-cups that you can take with you at your convenience to your office, even when you're traveling. So again, this is Expressoul Coffee. You can find our coffees at expressoulcoffee.com. I have a special discount for you, my listeners. So go to the description box, go to my website, expressoulcoffee.com, and get this amazing coffee that is delicious and is good for you because it's low in acidity, rich in antioxidants. Good for you. Thank you very much for your support. Today, our guest is Dr. Jennifer Simmons. Dr. Jennifer Simmons is a prominent board-certified breast surgeon in Philadelphia, where she was the chief of the breast surgery and director of the breast program at Einstein Medical Center, Montgomery. With over 15 years of experience in the field of breast disease, Dr. Simmons received the 2016 Top Honors Founders Award from the Living Beyond Breast Cancer Organization for improving the lives of women with breast cancer. Always at the forefront of medical advances in breast surgery, Dr. Simmons has been named Top Doc 6 years in a row by Philadelphia Magazine and also in Mainline Today 2018 and Suburban Life. Her own illness led her to discover functional medicine. She was so committed with the concept of creating health rather than killing a disease that she left traditional medicine and her esteemed surgical practice in 2019 to found her practice, Real Health MD, with the mission to help women anywhere along the breast cancer journey to truly heal. Dr. Jenn believes that health happens at home, not at doctor's office, not at the hospital system. It happens at home. So we are going to talk about all of that today because she's on a mission, very much like us here at Expressoul Health and Wellness Podcast, to empower women and population out there, women, men, and everybody, to take control of their health and really do something impactful in their lives to keep themselves healthier. Dr. Jenn is also a motivational speaker. She maintains her private practice, and she's frequent podcast guest and TV speaking in many outlets that we see today in media and in social media. So more than anything, she's a woman like me. She's a mother, a grandmother, a dog lover, an athlete, but especially an advocate of taking control of our health to live longer and happier life. Here is my interview with Dr. Jenn Simmons. Dr. Jennifer Simmons, thank you very much for being here at Expressoul Health and Wellness Podcast. It's a real honor to have you today to talk about breast cancer. This is a subject that is extremely personal for many women out there, and thanks for being here to give us your insights and your wisdom. Thank you so much.
I'm delighted to be here. I'm always happy to talk about breast health because it's so important. It affects 51% of our population, and it's information that everyone needs so desperately. And the truth is that even though breast cancer will affect 1 in every 8 women over their lifetime, the truth is that no one will get through their lifetime without being affected by breast cancer in some way. So either you're going to have it, or a friend or a family member or a neighbor or someone in your parish or someone in your community. No one is going to get through life without being affected by breast cancer in some way. So it's a conversation we all really need to have.
I'm so happy you're here because it's true. It is a one way or the other, and it's kind of like I'm a woman over 50. Every time I go and visit my OBGYN, I go to that appointment with excitement and a little bit of nervousness because I don't know what's gonna happen. I gonna have my screens. It's all the the fear and also the anxiety that something like that can happen to any one of us.
Yeah.
So I would like to start this conversation by asking you your own journey through breast cancer lead you to where you are right now, because you were on the other side of the traditional medicine.
I was.
And then you went through your journey with breast cancer, and that was like a big awakening for you. Please share with us that experience. What happened?
So, my story is like so many practitioners. I have a pain to purpose story. But mine started a long, long time ago because there's actually never a point in my life where I didn't know about breast cancer, don't remember breast cancer. I mean, it really embodied my entire childhood. So growing up, I had a first cousin. Her name was Linda Creed. She was a singer-songwriter in the 1970s and 1980s. She wrote all the music for the Spinners and the Stylistics. She wrote 54 hits in all. Her most famous song was The Greatest Love of All. She wrote that in 1977 as the title track to the movie The Greatest, starring Muhammad Ali. But it really received its acclaim in March of 1986 when Whitney Houston released that song to the world. And at that time, it would spend 14 weeks at the top of the charts. Only Linda would never know it because she died of metastatic breast cancer just 1 month after that song was released. I was 16 years old when my hero died. And when Linda died, it wasn't just a woman dying. She was as famous as could be. She was literally a rock star. She was brilliant. She was beautiful. She was the queen of Motown Sound in Philadelphia. And when she died, an entire community grieved her loss. And her life and ultimately her death became my life's purpose. So I did the only thing I knew how to do. I became a doctor. I became a surgeon. I became the first fellowship-trained breast surgeon in Philadelphia. And I, for a long time, practiced breast surgery, ran a cancer program, and thought that I was truly making a difference. And as I'm at the height of my career and having a very busy, full practice, running a cancer program, and I'm a wife and a mother and a stepmother and an athlete and a philanthropist, and I have all these balls in the air, and I fancy myself an expert juggler. And one day, everything just comes crashing down for me. And I go from being as high functional as you can be to literally, I can't walk across the room because I'm so short of breath. And I have this exhaustive 3-day workup, and I'm sitting in the office of my friend and colleague and physician, and he tells me that I need surgery, chemo radiation, I have to take lifelong medication. I completely appreciate the irony. I know that these are things that I say to people all day, every day, without hesitation or reservation. But when these words are coming at me, I just know that that's not the path I should take. And I left that office that day, refusing treatment. And he told me what I told my breast cancer patients all the time. When they ask me, well, what is going to happen if I do nothing? And I tell them they're going to die of their disease. And he told me I was going to die of my disease. But the thing is, I wasn't going to do nothing. I was going to find another way. I didn't know what that way was. And I was steeped in conventional medicine. I mean, I'm running an NIH accredited cancer program, for God's sakes. Like, I know what I was refusing was the standard of care. And yet I just somehow knew that there was something more. So I decide the place to start is with nutrition, because as a traditionally trained physician, we have 15 hours of training around nutrition, education around nutrition. That is in our first year of medical school, and then never again. So as a fellowship trained surgeon, I went to medical school for 4 years. I did surgical residency for 5 years. I did fellowship for 1 year. So I'm at 10 years of higher education. And in my residency, we were expected to work around 100 hours a week. So you can do the math and know that I had a lot of hours of training. 15 of them were around nutrition and nourishment in my first year of medical school.
This is ridiculous, Doc.
It's
You
ridiculous.
touch a point there. It's crazy. I know. How we can expect that when we go and see a physician that received similar, probably less education that you had, get the answers to see how we doing with our nutrition, what are our deficiencies if they have so little training on that regard.
The thing is, no one goes to the doctor to get healthy. And so our doctors are not trained to recognize health. They're not trained to create health. They're only trained to recognize failure. And, you know, when you think about it, when people go to the doctor because they know that they're losing their health, right? They go and they say, I have fatigue, or I can't sleep, I have unwanted weight gain, I have no libido, my joints ache. Like, these are the common themes that people go to the doctor with. And what does the doctor say? They order some rudimentary labs that don't really look for anything. They tell you your labs are normal and that you're fine. And what they mean is, go away and come back to me when you fail. And nowhere in our current medical paradigm are we trained to recognize the person that is failing. We only recognize the person that has failed. And It's complicated because the way that our medical system is built, we don't have a healthcare system, we have a sick care system, and we're trained to manage symptoms, but we're not really trained to heal anyone or cure anyone. That's not really the goal of the system. The goal of the system is to keep you dependent on the system. So keep you dependent on medications, keep you dependent on procedures. And it's not that physicians are not well-intentioned. They are. Everyone goes into medicine to make people better, but they're not trained to do it. And so they never do. And the longer you stay in that system with blinders on, the longer you perpetuate this and the further you get away from the truth. And so my diagnosis and my journey allowed me to discover functional medicine and discover the truth.
What year was that, Dr. Simmons?
So I got sick in 2016. In 2017, I found myself enrolled in IIN, the Institute for Integrative Nutrition. So I got sick late in 2016, and in January of 2017, I started IIN. And I was very, very skeptical. In fact, I called them probably 20 times and said, I've been a physician for a long time. Are you sure that I'm going to learn something? And so they assured me that they had lots of physicians enrolled in their program, and they promised me I would learn something. So I'm sitting in one of the very first lectures, and a man named Mark Hyman walks on the stage. Now, this is 2017. So yes, he had written some books, but he was not famous like he is now. And, social media wasn't then what it is now. And
Correct.
So, he walks on the stage and he introduces himself as a functional medicine physician. So my snooty booty self, I'm a doctor for 20 years at this point, and I say, there's no such thing as functional medicine. What is this quack talking about? And then I remember that I'm sick and that I'm there for a reason. So I turn off that ego and I focus and listen in, and thank God I did. Because within 5 minutes of this man speaking, my entire world makes sense. And not only do I know why I got sick, but I now know and understand my true life's mission. Because as a surgeon, I am affecting that one person that I'm working with, but I'm not doing anything to change the trajectory of their life or change the trajectory of their health. All that I'm doing is delaying the next manifestation. So if I remove the tumor, maybe the breast cancer doesn't progress as quickly as it could, but it's certainly progressing because I didn't change anything to determine why that breast cancer is there in the first place. I didn't do anything to affect that process that is already in motion. And even if they don't have a breast cancer recurrence, they're going to have something else. Because at the root of that breast cancer is inflammation. And that inflammation is just going to manifest as something else unless it is acknowledged and intervened. And so I have this incredible realization during this man's talk, during Dr. Hyman's talk, and it leads me to change the trajectory of the rest of my life. So,
do you remember his words? What was that short message that it was your aha moment? You remember?
Yeah. He's talking about symptom management and that this entire medical system is designed for a pill for the ill, right? Diagnose and prescribe. And nowhere do we really recognize where the problem is. So here I am, along with all of my brilliant colleagues in the cancer space. And what are we focused on? We're focused on the tumor. But the tumor is not the problem. The tumor is the symptom of the problem. And nowhere are we talking about why people got cancer. Nowhere are we helping people to achieve health, because we don't understand that health is not the absence of disease. And when he says that and says that health is optimum function, I'm like, oh my God, how did I miss this? How did I not see it? But again, because we're trained in this paradigm of diagnose and prescribe, we get into that tunnel, we go into that tunnel, and we never see the landscape around us again until something happens, until you have a diagnosis, until something takes those blinders off. And so the second I learned about functional medicine, I knew that there was nothing else, and that I am an early adopter. I get excited about things and I just go. So I enroll in the Institute for Functional Medicine. Mm-hmm. I spend the next 3 years just studying functional medicine and figuring out how to heal myself. And at the end of that 3 years, I walk away from my surgical practice because I knew that there was no way to get people healthy if I continue to operate, no pun intended, within the confines of conventional medicine. Because conventional medicine has it wrong. Unfortunately, it has it wrong. We are trying to manage chronic disease with an acute care system, and it doesn't work. And the current system doesn't even want it to work. It doesn't. The system is built to support and perpetuate illness.
It's what you said. It's a sick system, not really a system designed to prevent and keep the people healthy in the first place, because the incentives are into the sick people.
Yeah.
I mean,
yeah.
Really healthy people don't make money for the system.
It is designed for people to be sick. It really is. I mean, unfortunately, you look at things like the American Diabetes Association, and you look at the diet that they recommend, and that diet is a prescription to get diabetes. And, we wonder why people who follow that diet to a T don't get better and only have more and more drug reliance. It's because the system is built to perpetuate illness. It's, unfortunately, the medical system and the pharmaceutical industry they're partners. They're working in cooperation with one another. And we have completely lost sight about what medicine is supposed to be about. It's supposed to be about healing. But that's not what our system is built around. And I just didn't want to do that anymore. And, wow. we tell people that all these disease states are irreversible. And yet time and time again in the functional medicine world, we see reversals. So we tell people that diabetes isn't reversible, and it isn't if you follow the ADA diet and take all of their medicines. It's not reversible if you do that. Mm-hmm. But if you actually eat in a way that doesn't promote diabetes and move in a way that doesn't promote diabetes, guess what happens? Your diabetes reverses. And
I agree with you.
Same thing with heart disease and hypertension, and same thing with cancer.
We were actually last week we got a discussion about some of the guidelines that some of the experts at the Tufts University had in terms of ranking some foods 1 to 100, 100 being the healthiest. And surprisingly, a lot of over-processed foods were ranking way higher than whole foods such as ground beef, eggs. They actually rated the artificial egg white higher than the regular natural egg from the chickens.
Yeah.
So we were having a discussion about that, and we with that was with Saint Griggs. He's a specialist on fitness and your nutrition, and he had a book out there. It's called Kicking Ass After 50. So we were discussing about that nutritional part, and it's just very surprising, Doc, how some of what we call experts, researchers, are advocating for this kind of ranking that, yeah, they're being used as guidelines for promoting healthy foods against others. So it's something really wrong when overprocessed foods are being promoted and ranked over the whole foods that
Yeah.
we know today our ancestors ate is healthy and is good for the body.
Exactly. So this is where the disconnect is, right? Our egos are so big that we think that we can do it better than God, right? And so we have become so disconnected from nature, from evolution. Like we think that we've outsmarted it, that we've hacked it, right? And what do we have to show for that? We are sicker than ever. Ever. So I think like 92% of Americans lack metabolic health, right? So it's no surprise that a group of physicians has no idea what foods make you healthy, because they're among the 92% that are not metabolically healthy. They don't know how to do it. And this starts in the cradle. I mean,
True.
for years, people advocated formula over breast milk. You were considered poor or unprivileged if you were breastfed, right? And that we can somehow do it better. And that corn syrup and seed oils in infant formula is better
Heavy
than
metals.
breast milk. I know. It is disgraceful.
It is.
And then it just gets carried through. And people are eating these like artificial like soy protein isolate and pea protein isolate instead of the actual plant, right? And so we've created all of these artificial things, and a lot of what people think is healthy is messaging, right?
Absolutely.
Milk is
It's
good for
serving
the
some other
bones
agenda.
and whole grain goodness. And all you're doing is supporting propaganda and agenda. And it has nothing to do with health. So we've become so disconnected from what is real.
That's absolutely true. And I agree with you. We have discussed that here. In fact, in another of my podcasts, we were discussing about shamanic medicine. And I did a lot of studies on that earlier. In when I was way younger, I went to, Brazil and Ecuador, and I was in Colombia, in Mexico, learning from some shamans about shamanic medicine. I get very intrigued, and they actually, the way that they see health is so simplistic, so beautiful, because they say exactly what you just said. The single cause of all diseases is the disconnection that we have with nature. We were disconnected from whole food sources, from nature as such, nor grounding, nor receiving the sun, nor consuming good water, nor having a good sleeping, nor getting in touch with what is really good for our bodies. Everything happened from there. All sources of disease and disharmony with nature. So that's what they said. It's simple. They said, you go back to nature, you go back to connecting your body with what is real and what is good. You'll be back to heal.
Yeah,
And so
it's so true. I mean, think about it just in terms of, you mentioned the sun. So we have completely villainized the sun for the purposes of selling sunscreen. And what has happened? We've become a vitamin D deficient society, and cancer rates have skyrocketed. Now, we're covered up, we're wearing our sunblock. Why are the cancer rates going up, right? And we've become so disconnected. The sun is not there to harm us. The sun is there to provide us with life. But we villainized it. We villainized it. And, you think about it, how do the plants protect themselves from the sun? It's because they have all of this antioxidant. So if we would just eat the plants, we would be protected from the sun. But what do? We eat a bunch of frankenfoods, pseudo foods that are like completely nutritionally deplete of anything. We are undernourished, and then we expect our bodies to be healthy when we deprive it of all of the things that drive health. What drives health? A whole food, plant-based, nourishing diet, getting out into the sun and getting exposure to the sun, drinking clean water, moving. We were not meant to be sedentary, prioritizing sleep. What did our ancestors do when the sun went down? They went into the cave and they went to sleep, because if you were out wandering around at night, guess what you were? You were someone else's meal. And we've just strayed so far from our evolutionary roots that our bodies just they can't possibly be healthy because we're depriving them of everything that drives health.
Absolutely true. So, Doc, I would like to touch on something, because I would like to go back to the nutritional part, because I think this is very key. But in terms of the traditional medicine system, because our listeners, a lot of our listeners are people that if they get diagnosed today, actually I had some of the stats here, and they said by the end of the year 2023, over 300,000 women will be diagnosed with breast cancer. We're not talking about the other cancers, just breast cancer alone. So the first approach, they probably gonna get diagnosed, and the same doctor diagnosing them is gonna prescribe a procedures or a treatment, follow-up treatment that is the traditional approach to the breast cancer. Where do you think that the traditional system had the flaws? From the diagnosis or after, or the whole thing?
It starts earlier than that. So let's first talk about how people are getting diagnosed.
Okay.
So in the 1970s, we developed the mammographic screening program. And the mammographic screening program is based on this premise. Breast cancer starts small, grows to some critical size, at which point it is more likely to metastasize. So if you find a breast cancer before it hits that critical size, you can save lives, right? It's a really nice theory. It also turns out to not be true. So the growth of breast cancer is not predictable, and it's not linear. So we just keep expanding the mammographic program, and our imaging gets better and better. So what do? We're picking up more and more things in the breast. We're diagnosing things smaller and smaller. But many of those things wouldn't come to fruition. Only now we've biopsied these people and we've given them a diagnosis. So now they have a bell that they can't unring. And so people with changes in their breast that probably would never affect them over the course of their lives are now getting aggressively treated for breast cancer and having all the consequences of that, because none of our current treatments for breast cancer make anyone healthier. No one ever got healthier because they had surgery, because they had chemotherapy, because they had radiation, because they had hormone blockade. In fact, they got a lot less healthy. When we look at the population of women who are treated for breast cancer, they are 2 to 3 times more likely to die of heart disease than the general population. And this is why.
Wow.
We never intervened at why they got breast cancer in the first place. So that inflammation, that stimulus for breast cancer is still there. And instead of manifesting as breast cancer because we kind of took that risk away or delayed that risk, it's now manifesting as heart disease. The second reason is that every one of our treatments for breast cancer accelerates heart disease. So we're actually taking a problem and creating another one. And this is a huge issue that we are not talking about. And I want to know why. So the other thing about the mammographic screening program that I have to mention is that in its inception, we were using 2D mammograms. It had a certain amount of radiation exposure. Now we're using 3D mammograms, and the callback rate is anywhere from 30% to 60%, depending on where you are in the country. So now people are not just getting one mammogram a year. They're getting many mammograms a year, and all that radiation is building up. So I never really understood using a test that causes cancer to screen for cancer. And when we look at women over a lifetime, for every 1 in 1,000 women whose lives we save, we will cause 7 breast cancers because of mammographic screening. This is a problem. That our screening program is built on something that causes cancer. It's a huge problem.
So, Dr. Jenn, I mean, again, this is, and I go to my screen every year. I'm over 50. I go to my OBGYN. First thing she prescribed is the mammogram. Sometimes they couldn't see one thing, got another one. Then I had to go a second time. So I'm just speechless just to hear the stats that you reveal here about this radiation that build up in the human body, and as we do over and over these screens. So my question is, if it's not through the mammogram, how to diagnose appropriately the breast cancer?
Yeah.
What are other tools to do that?
So I do want to say that no matter how many breast cancers we diagnose every year, the same number of women will die every year of breast cancer. That has not changed. So the meaningful breast cancers don't change. So every year between 42 and 43,000 women will die of breast cancer. And that number we're not impacting. So that is really the question that we need to be asking, is why can't we decrease the number of women dying from breast cancer? But the question you're asking is like, what should we do to screen? So I first want to stress that the very best thing that you can do is live an anti-inflammatory life, because that is going to prevent the development of breast cancer. But I surely know that everyone wants to be aware and do everything that they can do. But I don't believe in farming out your health, and I don't believe in farming out your screening. Now, that said, I am going to talk about the newest, latest FDA-approved way to screen the breast that will replace everything. It's going to replace mammogram. It's going to replace MRI. And it's here now. And within the next 5 years will be very widely available.
What is that?
It's called QT imaging. And it is similar. The closest thing to it, it's a novel imaging technique. The closest thing is ultrasound, but it doesn't require a wand. So it is basically sound waves that are transmitted through a bowl. So it is painless. There's no radiation. It is fast. It takes about 4 minutes to screen each breast, somewhere between 4 to 7 minutes, depending on the size of the breast.
Amazing.
And it is 40 times more accurate than MRI.
Wow.
40 times more. So the entire test for both breasts will take about 15 minutes. It involves submerging your breasts in a bowl of warm water. So it's like a breast bath. And a normal QT scan will mean that you do not need another study for 2 years. That's how sensitive and specific it is.
And the technology is already available?
Mm-hmm. Yep.
Wow.
So there are currently 8 imaging centers in the United States, and I have 2 partners that I'm working with, and we are intent on making sure that everyone who wants a scan will be able to get a scan in the next 5 years. We're intent on opening up centers and making it readily and widely available.
Now, my question, Doc, it is this new technology covered by insurance, or this is
So it
a la
will
carte?
be eventually like everything else, but the scan, depending on where you're having it done in the country, is somewhere between $300 and $400. And if you have a normal scan, that means you don't need another scan for 2 years. So would you pay $175? Let's just take the average. Would you pay $175 for a painless, radiation-free study that is going to give you a definitive answer and give you peace of mind?
Absolutely.
I know I wouldn't think a thing about it.
I know. And this is great news. This is music to my ears just to know that we're talking about something now that it will impact the state of health of many out there, because it's going to be an effective way of diagnosing.
Absolutely. And in the meantime, I do think that everyone really needs to dial down into themselves. We need to be in touch with ourselves. We need to be in touch with our health. You need to know what your breasts feel like, and you need to know what your breast looks like. I was listening to someone this morning talk about how grateful they were that the mammogram found the walnut-sized mass in her B cup breast. And I'm thinking, how on earth do you have a walnut-sized mass in your B cup breast and you don't know about it and the mammogram has to find it? I mean, we've just gotten so far away from knowing ourselves, from being in touch with ourselves, from being in touch with nature, that I don't understand gratitude for a test to tell you something that you should have known about yourself. And we need to stop farming out our health to people who are not invested in it. Like, the mammogram company, they are not invested in your health. Your doctor isn't really even invested in your health, and no one is going to care about your health more than you. And we also start to care. Agree. We need to start to care. We shouldn't be going to the doctor to get diagnosed with a breast mass. We should, if that breast mass is going to be there, we should know about it first.
I think sometimes, Doc, it's just, again, so much awareness about breast cancer, so many we see in social media, a lot of doctors advocate for you to do your self-exam, touch your breast. You're taking a shower, just do an examination yourself if you see that something is abnormal. But I think as much as we emphasize on that, we don't do it enough, because a lot of women still not do it.
Yeah. And that's because we've become accustomed to farming out our care, right? Make it someone else's responsibility.
Correct.
This is the American way. Make it someone else's responsibility. I remember I was giving a talk to a group of women with metastatic breast cancer. And I was talking about sleep and the importance of sleep, because sleep is our restorative phase, right? Sleep is where the healing happens. And so if you're someone with metastatic breast cancer and you're not sleeping, there is no way to reverse your disease. Like, there is no path to healing that doesn't involve sleeping at night. And I remember this one woman spoke up afterwards and she said, what you're saying may be true, but it's so much easier for me to blame the doctor or the pill or the procedure than blaming me. And that is part and parcel to what is wrong with our medical system, is that we have stopped taking responsibility for our health. We have completely dissociated from that. And what's the result? We're sick, and we're plenty sick. We're way more sick than we are healthy.
I mean, Doc, when you understand that our annual spending on healthcare in this country, 80% of those over $4 trillion is gonna be like close to 6 or 7 by 2040.
Yeah.
Is a lot. 80% of the spending a year is
Yeah.
dedicated to chronic illness.
Yeah.
So just to
Yeah.
treat it. So
Mhm.
if we know that 80% of the population is reflect the state of health is wrong, is reflecting on inflammatory diseases, why not invest in that money in prevention? I just still, it blows my mind that
I
the
say this all
is
the
a poor
time.
investment.
Yeah. And I actually comment when organizations post about new drugs being approved, and when you actually look at what those drugs do and they extend life for 6 weeks, 6 weeks, 6 weeks of sickness, of suffering, and we're celebrating this, and it took about I'm exaggerating. It took about $600 million to bring that drug to market, and we're celebrating 6 weeks. That will only work in about 8% of people, and we're celebrating. We are so lost.
I
We are
know.
so lost.
I know,
And
Doc, and
that
that's why.
80% that you were talking about, do you know that 80% of that is reversible by
Oh
diet
my
and
God.
lifestyle alone?
My God. That's why, Doc, this kind of channels, this kind of podcast, when we open the stage to understand, to be an advocate, of take control of our health. You have your own health journey. I had mine. When I went and they were going to take me to a surgery to remove my organs and open me from here down there, they were not giving me other option but that. I say, wait, what? You're telling me that today, with all of these advances, we have AI, we have all of this technology, you're offering me the same solution that would you offer a woman 50 years ago? I don't need that. And I was dying. I couldn't even type in my computer. And I went to do my research until I found a solution that was not only appropriate for me, it was perfect and saved my life. But if I was attending only what my doctor was telling me, I was going to get a lot done that was not exactly the best for me. So
No.
it's taking control
And
of our
irreversible.
lives. Yeah,
Irreversible, right? And
totally.
so I want to be clear. I am not throwing the baby out with the bathwater. There are some wonderful, amazing
Yes,
things in conventional medicine, right?
absolutely.
Things that we are able to
Acute
do
care is
things.
excellent with
Yes,
them.
amazing.
Broken,
If you,
fix the
yeah,
broken. Go.
yeah,
Perfect.
yeah,
Best, best, best.
absolutely, absolutely. However, we cannot continue to use that mindset to help people with chronic disease. It simply does not work. And so
Absolutely.
I,
And then,
for the
Doc,
population of people that have very advanced cancer, that they have a lot of tumor burden, I believe that the best thing for them to do is to get chemotherapy or radiation. They're in terrible pain, they're suffering. That is a quick fix for sure. However, their proverbial sink is overflowing, right? So we need to mop up the floor. Chemo, radiation, they mop up the floor. But the far more important thing, the thing that is going to make the difference, is turning the goddamn faucet off. We got to turn the faucet off. And that's where all of these things that we're talking about come into play. You cannot get better in the same environment that you got sick.
that
If you
is
want change, you have
perfectly
to change.
said. You're absolutely right. You're absolutely right, Doc. And another thing that you mentioned is that we are different one to another. So I always question that the same solution work for everybody.
No, of course not. Of course not. So, it's all bio individual, but there are foundational things that everyone has to do. right? So we talked a little bit about sleep. Like you cannot heal if you're not sleeping. Now, sometimes the disease state interferes with sleep. So people with mold illness have a really hard time sleeping because they get particularly anxious at night. People who have parasites have a hard time sleeping because the parasites are active at night. So sometimes you have to work with them to correct the disease state. But if we are talking to people about eating a whole food, nourishing diet, and we're talking to them about moving their body because we are meant to move, we are meant to be active. If we're talking to them about their mindset, about stress management, because the stress is always going to be there, the stress itself doesn't matter. It's how you deal with the stress that matters, what you internalize, what you allow to have meaning. It's about avoiding toxics. We live in an ever increasingly more toxic world, but we can choose to manage some of that. We can choose to not do a lot of the toxic things. It's about learning how to detoxify your body. It's about, making sure that you're exercising and sweating and peeing and pooping and drinking filtered water. And then it's about having a purpose-driven existence. We all have to live for something. You don't have to change the world, but you have to have meaningful relationships. And you can't continue to live in a toxic environment and expect to be well.
Absolutely.
And so we need to do everything that we can to get back into circadian rhythm, get back into living in concert with the sun and with the moon, respecting those boundaries, and eating in an evolutionary way, moving in an evolutionary way, thinking in an evolutionary way. This is how to promote health. And when you promote health, disease goes away. So, everyone's nuances may be a little different. Some people are dealing with mold. Some people are dealing with metals. Some people are dealing with viruses. And I certainly help to correct those, but no one is going to get better on a processed food diet of blue light, no activity, and poor food choices. It's just not going to happen.
I agree with you. So, Doc, talking about specifically the causes of the breast cancer, you have addressed here enough that, inflammatory conditions will lead to the disease and many others as well.
Yeah.
But we hear in our, for many years that estrogen is the cause of the breast cancer. The imbalances of the estrogen can be the cause of breast cancer. What are your thoughts about that?
So think about the states that estrogen is the most abundant.
Mm-hmm.
Teenagers, women in their 20s, pregnant women. These are populations where we hardly see breast cancer.
Correct.
So if estrogen were the problem, why are we seeing it by far the most in the population of women in where estrogen is deplete, in the perimenopausal, postmenopausal woman? That is where estrogen is by far more common. Breast cancer is by far more common.
Mm-hmm.
And I actually think estrogen is protective. And I think that it's when we lose our estrogen and our cells go in search of it that we get into these issues. There is an excellent book called Estrogen Matters by Avram Blooming and Carol Travis. That I think that is a breast owner's must read. So everyone that has breasts needs to read Estrogen Matters.
Beautiful. We're going to put the notes in the description box for our audience.
Yeah.
To reference that book and the author, because absolutely anything we can give to our audience for them to get informed, I think is an excellent idea. So, Doc, talking about the estrogen, And again, I am over 50 and I go to a very highly qualified doctor for my
Mm-hmm.
hormone replacement
Mm-hmm.
therapy. I have several in my podcast before, and they can stop addressing how important is to keep all your hormones in balance, especially when they get depleted with the aging.
Mm-hmm.
And they said, Claudia, for women, it doesn't happen at the same time for everyone. So start checking on your hormones in the later in the 30s is a good idea. And the 40s is an excellent idea, even kind of like please do it. If you are approaching your 40s, go check your hormones
Yeah.
and get back to balance, because
Mm-hmm.
the hormones are protective to our organs, to our circulatory system, to our skeleton, muscular system,
Yeah.
to our brain. And now you're
Absolutely.
telling us to our breast.
Yeah. So when we look at the population of women who take hormone replacement and get breast cancer, first of all, I want to be clear that it's not the hormone replacement that caused breast cancer, because plenty of women who are not on hormone replacement get breast cancer, right? But there is
Mm,
a population of women who take hormone replacement and get breast cancer. And when we look at that and compare them to the women who don't take hormone replacement, the women on hormone replacement do better across the board, do better. So I am a firm believer in hormone replacement. Anna Kabecka told me that menopause is mandatory, but suffering is optional. And, you know, even if you don't have the symptoms of menopause, right? Even if we're not talking about the hot flashes and the sleep disturbance and the mood disturbance and the lack of libido and the vaginal symptoms and the vasomotor symptoms, which alone are enough. But even if you don't have any of those, the benefits of hormone replacement are inarguable. It protects your heart. It protects your brain from Alzheimer's. It protects your bones from osteoporosis. And anyone who tells you that we have other things for that, like SSRIs for the depression and the anxiety, they don't work. Bisphosphonates for the bone loss, doesn't work. Lipid lowering medications for heart health, doesn't work. The only thing that works to protect all of those body systems is estrogen. Why? Because that's what we were meant to have. And the fact that we go through menopause and there's a lot of belief that it's unnatural to replace hormones after that. Remember, we were living during times when we died of the common cold. We died of strep throat. We died of, things that we don't die from anymore. So we're living very long with that heart and with our skeletal system and with our brain. And we want to protect that. We want to do everything we can do to protect that. And I'm especially bothered by the fact that we discount the symptoms of menopause. And can you imagine if you said to a man, okay, starting at 50, you're no longer going to have any interest in having sex, but you have to have sex because otherwise you're going to lose your relationship with your partner. And it's going to be awful and painful, but just like white knuckle your way through it. And don't worry, it's only going to last for the next 40 years. I mean, can you imagine having
no,
that conversation with a man? The
no,
man would
no.
be like, you're
What
out
are
of
you
your
talking about?
mind. And that's never happening. But
Yeah.
that happens to women all the time, right?
Yes.
Like, don't just get through it. Just get through it.
No,
Well,
dog.
I don't
And
know about
again,
you. I don't want to just get through it. And I don't
no,
think I should have to.
no.
So I come from a breast cancer family. I mean, literally every woman in my family has breast cancer, with the exception of my mother, who had colon cancer. When my time came, I came out of training in 2003. So I came out of training just as the Women's Health Initiative was released. And for 20 years of my career, I believed that hormones were the devil, right? They didn't protect your heart. Because that's what the original study was powered for. It was powered to determine if they protected against heart disease. Only they put women, the average age on that study was 63. So the most acceleration of disease happens within the first 10 years. So if the average age of menopause is 52 and we're using 63-year-olds to do the study, of course it's not going to protect against heart disease. The damage is done.
Done. Mm-hmm.
But if you look at putting women in their early 50s on hormone replacement, it completely protects against heart disease, and it's inarguable. So I come out of training getting told that it doesn't protect against heart disease, it doesn't protect against dementia, it doesn't protect your bones, even though it wasn't powered to determine if it protected against dementia or bone loss. And so for 20 years, I walked around with those blinders on. And then I read Estrogen Matters. I don't remember what year it came out. And I was like, oh my God, this makes so much sense. And even in my practice, I believed that estrogen caused breast cancer. And like nowhere did my logical mind say, wait a minute, most breast cancer happens in women that have like no estrogen. How is this possible? But we accept these things on blind faith. We think that someone else did the work. And it's out there, and it's so prevalent it must be true. And we never think about the fact that it's so illogical it couldn't possibly be true. Now, are there some women who struggle with estrogen detoxification? For sure, 100%. And so before I put anyone on hormone replacement, I am making sure that their detoxification channels are open and in place, right? I am also optimizing their diet. I'm making sure they're moving. I'm making sure they're sleeping. And when all of that is in place, I'm getting rid of all of the xenoestrogens in their environment, right? We are surrounded by environmental estrogens, and they do not act like our estrogen. And in fact, they are the reason that we have more breast cancer.
Wow.
Is because of all of these environmental estrogens. Things like plastics and fragrance and antibiotics and nonstick cookware and all of these things that are so prevalent. They're everywhere in our environment, and they are acting like toxic estrogen, not our estrogen. God would not give us a hormone that causes breast cancer. It's ridiculous.
I love what you're saying, Doc. And this is music to my ears. We have been discussing this on my podcast with different specialists. And in fact, I had a conversation with a compounding pharmacy back in the day, and they were telling me they had a case of a lady, and they were actually the compounding pharmacy person, the owner was a friend with this particular doctor who was neurosurgeon, and then he has a psychologist specialties. He got this patient, a woman in their 50s, and the woman had tremendous depression. They start treating her for depression. Months after months, she did not show improvement. She was actually more depressed and now isolated from the family. She didn't want to interact with anybody. She was taking the medications they were prescribing to her. Nothing changed. So this friend talked to the other friend that was the compounding pharmacy guy and say, I don't know what to do. I really want to help her to a beautiful family. She has the perfect husband, perfect family, and she's so depressed. I don't know how to help. Happened in that conversation that the person in the compounding pharmacy say, look, I had another friend that is also a doctor. He's a specialist in hormone replacement therapy because I'm compounding some of the special hormones for them. Why you don't tell this person to go? Short story long, this woman get the appropriate diagnosis, everything on the basics of her problems were imbalances of her hormones. Once she get treated, the hormone was prescribed, compounded for her needs. Months after, this pharmacy received a big arrangement with flowers and chocolates and stuff, and they, who's sending us this? So they look, it was the husband of the woman. He was so grateful. The big takeaway from this is many problems in women may lay into the hormone imbalances, and we, again, as the media demonize other things, so the hormones too. And now we're seeing more and more research that validates the benefit of having the balances in the hormones, and this is just so important, Doc. So we have been talking about.
I'm gonna go one further.
Yes.
Because depression is never depression. Depression is always inflammation and imbalance. Always. So it's coming from somewhere. It's coming from your gut. It's coming from your adrenals. It's coming from somewhere else. It's coming from a hormone imbalance. But depression is never depression. It's always a reflection of something else. And we're trained to think about this mentality like, oh, you have depression, you must have a lack of serotonin. Let's give you a serotonin reuptake inhibitor and increase your serotonin levels around your receptors, and all will be better. And we know from the papers published in the last year or two, it doesn't work, because that's not what depression is. Depression is always something else. It's a symptom. We have to stop thinking about that's the totality, that's the destination. It's not. It's a symptom of something else. And what you have to figure out is, what is it a symptom of?
Oh my gosh, Doc, so much to talk about that, but I love the way that we are explaining here with you so clearly those preventive measurements that we can be, all of us listening at this podcast, can we be implementing in our homes. You're talking about nutrition, just eating the whole foods, instead of the over-processed foods. We're talking about taking care of the sleeping, detoxification, exercising. I mean, all of that is very, very important. You told us about all of these new technologies to diagnose that are available right now, will be widely available in the very near future. That is exciting. But tell me, for our audience that are already being diagnosed and they are going through the traditional treatments that traditional medicine offered, what they can do at this stage. And again, I'm telling you this, I'm translating these questions from someone that I know, not personally, but I know she's going through this early diagnosis. She got diagnosed and she's going through the whole chemo.
Yeah.
And she's weak and worried and is a young mother with beautiful children, an amazing family. What we can tell those women that are in that stage right now?
So I know it's like hard to hear, but the same things that drive health in a person pursuing health is the same thing that's going to reverse disease in someone who's sick, right? And so that person that has been diagnosed with breast cancer and is going to have treatment, yes, there are absolutely things that you can do to maximize your health. So the work of Walter Longo, he wrote about the fasting mimicking diet. So if you fast while you're getting chemotherapy, you dramatically increase the effects of chemotherapy on cancer cells while dramatically decreasing the effect on normal cells. So by fasting and putting our normal cells in this kind of quiescent state, cancer cells are not able to do that. Cancer cells have to stay active. They are perpetually on. So if you give chemotherapy to someone whose normal cells are quiet, but the cancer cells are on, guess what's going to happen? The cancer cells are going to be affected and the normal cells aren't. So all of my patients who are going through chemotherapy, I have them fasting. I have them fasting while they're getting chemotherapy. And you know what? They have energy. They're able to exercise. They're able to sleep. They don't get gastrointestinal issues. But you also have to be mindful about how you're eating. I think that there is a whole culture, a thinking of no matter what you do, don't lose weight. Well, guess what? Weight loss is probably one of the most beneficial things if you need to lose weight. It's probably one of the most beneficial things that can happen to you while you're getting treated. Because if you are losing weight, it means that you are getting rid of toxins. And toxins are one of the major drivers of disease. So you want to get rid of those toxins. So if you are overweight and you carry a cancer diagnosis, you want to do everything you can to shed that weight. That is another symptom of your disease.
Okay, what is the
And
name of the doctor you mentioned, Dr.
Dr.
Simmons?
Walter Longo at USC.
Okay, we're gonna have that reference also in our
Yeah.
description
Yeah,
box.
absolutely. And he
And
talks about the fasting mimicking diet. And a lot of
wow.
people recognize that as Prolon. That is the brand that he developed. It's a 5-day fasting mimicking diet. So you're eating, but you're eating beyond the threshold of your body recognizing that there's food coming in. So your body thinks you're in a fasted state. And in a fasted state, that's when our cells undergo cellular repair. But cancer cells can't do that. So cancer cells in a fasted state just get really super pissed off. Like they just want glucose and they're going to do whatever they have to do to get it. And so fasting is one of the quickest ways to healing. And I always include some kind of fasting in my treatment paradigm for people. But there are a number of ways to eat, drink, think, move while you're getting treatment. And then that sets the stage for the real work that needs to be done, because the day you ring that bell is the day your healing starts.
Wonderful. I would like to tell our audience that in your practice, which is Real Health MD, you have designed a course that is 12 weeks and it's called My Answer to Breast Cancer. And we're talking earlier on this conversation about how important is that the treatment is personalized because each patient is different. Tell
Yeah.
us about this course, Dr.
Absolutely.
Simmons.
So, the thing is that cancer is a normal response to an abnormal environment. And we think that people who get breast cancer have a bad breast, but they don't have a bad breast. They have some kind of environmental shift and their chemistry has changed to stress chemistry. And what we need to do is shift that back to the chemistry of joy so that your breast cells feel safe, because your breast cancer is every bit a part of you as anything else. And it's just that breast cells are especially sensitive to environmental shifts. So what we want to do is we want to teach people how to shift that environment back. So how to create that anti-inflammatory environment. And that's what My Answer to Breast Cancer does. It gives you all the tools that you need to create that anti-inflammatory environment. Now, will that be all everyone with breast cancer needs? No. But if you follow that, it will get you 80 to 90% there. And then, some people will need some testing beyond that. Some people will need some tweaks beyond that. But if you have that foundation, if you create that anti-inflammatory environment, our bodies intuitively know how to heal. We just need to give it what it needs and take away what is not serving it.
All of that information is going to include in our description box about your practice, about My Answer to Breast Cancer course. Everything is going to be there for the benefit of our audience. One question before we finish, Dr. Simmons, what about, on the protocols of anti-inflammatory practices that we can implement here? We talk about, sleeping, exercise, diet. being one of the most important ones. What is your opinion on saunas, the frequent use of saunas?
Infrared
And I
sauna?
cannot ask
Yeah,
you
so
that.
I love infrared sauna. I like anything that is going to ignite detoxification.
Yes.
So I think that everyone needs to be drinking filtered water. You should be urinating multiple times a day, and that urine should be almost clear, right? That's how hydrated
Mhm.
you should be. And we need to be pooping every day, at least once a day, if not 2 or 3 times a day. And we need to be doing these detoxification practices. So I have my breast cancer patients going into their sauna at a minimum of 4 times a week.
Yes.
Ideally, I would love them in there 7 days a week. And
Beautiful.
I often encourage people to go in hot. So do some exercise that is going to provoke sweating for about 20 minutes. Drink hot green tea, hot yarrow tea, something like that, and then get in that sauna and sweat it out.
Beautiful, Doc. I love what you're saying. I got my infrared sauna right behind us. And sauna has fixed two things for us in this family. My husband is 75 years old. He had a lot of problems sleeping. And for years, he was prescribed pills to sleep. That is no longer the case in this house since last year when we brought our infrared sauna. And actually, I became so advocate of that I got affiliate codes on my description box. I have a huge discount for the listeners that want not quite one of these infrared saunas from Clear Light Sauna. But the thing is that not only the sleeping get fixed, because after that detoxification is 45 minutes of profound, I mean, you just sweat, take a shower, go to sleep, sleep through the night. Like I mean, that was a big benefit, but also the anti-inflammatory effects. I should tell this story because it happens last week here, and I just that day, I'm telling you, I called the urologist. I told him, if this is not a proof of anti-inflammatory procedure, I don't know what it is.
Yeah.
He got, because he's 75, he got his PSA for prostate cancer, very checked every 6 months. They checked his levels, being very high, but not abnormal, very high for eczema of 5, for being having a big prostate, is over 75 years old. Since last year that we started going into the sauna, we go 5 nights a week. Sometimes during the weekend we go 2. So, in average of five days a week, we go to the sauna for 45 minutes every night. The levels of his PSA from last year to this year is the reduction. It was nothing different. A diet, nothing. But the sauna, the use of the sauna. I'm telling you, I will have tears in my eyes. I just called
Yeah.
the urologist and I said, please tell more to your customers.
Yeah.
They can get one of these devices at home.
Yeah.
Why are not more popular when
Yeah.
it's something that clearly
Yeah.
reduce the
And
inflammation of
even
the
if you
body?
don't have even if you don't have room for a big sauna device, you can get the higher dose infrared sauna blanket
Yes,
and use that.
absolutely.
And so there's really like no reason that people shouldn't be taking advantage of this.
Yes.
And next you have to do the cold plunge. That's
We
the
jump
next
into the
thing.
pool here.
Yeah.
It works
So if you can I mean, even if you just turn your shower to cold for the last
cold.
30 seconds, it is going to make a huge difference. That is another great way to build your immune system.
This is so good. What a conversation, Dr. Simmons. And again, I am asking some questions from people like me that are, thank God, healthy, but from other women out there that are going now through all of this emotional journey and getting diagnosed and going through the treatment. And we didn't talk about that emotional part. You seeing this over and over, you dedicated your life to the healing of the breast cancer, and you know how personal it is, how emotionally impacted get not only the patient who was diagnosed, but the family members.
Yeah.
What is your message on that regard?
Yeah. So, ultimately, we have to remember that we have so much more power than we think. And our diagnoses, these are messages. They're not blessings. It's not a blessing to get diagnosed with breast cancer, but it is a blessed opportunity. It's an opportunity for you to take stock in your life, figure out what's working, figure out what's not working, and reshape your life in a way that fosters health. And the vast majority of my patients, the one that see it as an opportunity rather than a punishment, they actually know better health after their diagnosis than they ever knew before in their life. So if you can frame it, if you can frame your diagnosis as an opportunity, and it's not easy to do. I know, I've been there. I know the pain of having a life-threatening diagnosis. I know. And there are plenty days where I felt bad for myself, plenty days where I cried my eyes out, plenty days where I said, why me? Plenty days where I said, I'm not strong enough to do this. But find the strength, find a little bit of strength, get up and go for a walk, look around you, appreciate nature, get into the sunshine, eat whole foods, eat lots of colorful foods, prioritize sleep, make sure that those relationships that you have are working for you, take the trash out, get rid of as many toxins as you can, do the detoxification work, and live your purpose.
Dr. Jenn, what would be your message for those husbands that silently are keeping the feelings inside or seeing their wives going through these treatments and the suffering that it is part of it? What would be
Yeah.
your message for those?
Yeah, get on the journey with her. Take this journey together. It is an absolute rarity that a wife has breast cancer and the husband is perfectly healthy. Again, we've become so detached from health and what it means to be healthy. And we think of health as the absence of disease, when in fact, health is optimum function. And if she needs it, you need it too. Go through it together. Be partners. Be partners in health. Be partners in wellness. Be partners in life.
Thank you so much, Dr. Jenn. We appreciate this conversation today, your words, and it's so much more. I have 3 more pages of questions here, but we're going to invite you in another time because it is a lot more that we would like to learn from you. And I want to invite our listeners to please leave us your comments at the additional questions for Dr. Jenn Simmons. We would love to have you in another opportunity here to address
I
those
would
questions
love
that
to
I
come
am
back.
sure they're going to put into the comments on this podcast. And it's going to ignite that conversation about how we can prevent breast cancer or any other cancer, what we can do from our hands to prevent that from happening, and also for those women that are going through right now the process of being diagnosed and going through the traditional treatments. What is those questions that they would like to ask you? And again, all your information of your practice, and the website and where to find you, everything is gonna be included in our description box.
Yeah, and
This is an ongoing conversation, my
we'll give
friends.
you a breast owner's guide.
That'll be wonderful.
Yeah.
That'll be great.
Yeah,
And
we'll be
thank you
sure to get
so
it to your
much.
listeners.
Thank you. Oh, that would be great. So please do communicate with
Yeah.
Dr. Jenn Simmons' practice, Real Health MD. Again, all of the information is going to be included in our description box. We love this holistic approach to healing because, as you say, Dr. Jenn, the objective here is not treating symptoms, is healing that patient. So thank you very much for your wisdom today. And for all of you out there, my friends, remember, health is wealth for the body, mind, and soul. If you like the content of our podcast and you haven't subscribed yet, please subscribe right here and hit the notification button. Also, follow us in all our social media outlets. We really appreciate it. Leave your comments below. We like to hear from you. We want to know what are those questions that you would like for us to talk to Dr. Simmons next time. Also, if you have a topic of your preference that you would like us to bring a real expert to talk about it here in our podcast, we appreciate your feedback. We appreciate you being with us every week. And again, remember to go to our description box, support our podcast, support this channel by purchasing the products from our sponsors, Expressoul Coffee. We appreciate it very much, your support. And again, until next time, remember, health is wealth for the body, mind, and soul. Take care.
Thank you very much for listening. And if you like the information that we shared with you today, please subscribe to the Expressoul Health and Wellness podcast and follow us in the social media outlets of your choice. Until next time, please remember, health is wealth for the body, mind, and soul.